Good morning, ladies and gentlemen. It's a pleasure to be here. And we examined what is the role of dental conditions or gum disease and psoriasis. It's been an old tradition to look for inflammatory foci of different kinds, and also the teeth and the gum disease. And we looked for several parameters. This work was done by a young dentist, and we had the patients, and we report what we found. Now, gum disease is a condition like this, and it has several degrees of severity, as you can see here. And we examined whether there is an enhanced periodontal risk, an increased IL-1-mediated inflammation, increased bacterial load. Bacteria are very important. There are about 400 to 700 different species of bacteria in the mouth, not just strep and staph, no, quite a few others, as has been reported this morning. And what about oral hygiene and risk for tooth decay? And this is how the sampling was done. And we had a questionnaire for these patients. They had to report different things like diabetes, hematological disease, HIV infection, smoking status, which is very important, and a family history of dental history. And then there were other parameters, for instance, periodontal status and DMFT index, decayed, missing, filled teeth, bleeding on probing, periodontal screening, and the probing of the gum pockets was done with an instrument, and more than 3.5 millimeter of depth is associated with the gum disease. Then bacterial analyses, and this was all ascertained by statistical methods. Well, first, the smoking status. Patients with psoriasis were strong smokers more often. A strong smoker is smoking more than 20 cigarettes a day, and psoriasis patients are very largely represented here. Non-smokers, there were practically none in psoriasis. Tooth brushing, dental visits, and interdental cleaning. Interdental cleaning wasn't hardly ever done by, or not as often by psoriasis patients. So they neglected the interdental spaces. And also dental visits, preventive or visits that were less frequent. So psoriasis patients don't care about their teeth. And decayed, missing, and filled teeth, these were actually the same in both groups, in the healthy controls and the psoriasis patients, which means it's not the teeth themselves that are severe for psoriasis. No, it's the gum disease that's the important thing. And the periodontal status, bleeding on probing, and all of these parameters were higher in psoriasis, like gingival pockets, more than 3.5 millimeters. They are more often occurring in psoriasis patients. And bleeding on probing also occurs more often in psoriasis. And there was, these can be summarized by a periodontal screening index, and this together was also higher, significantly higher in psoriasis. And the gingiva and the periodontal tissue, the health status, and this was also much severe in, it was the other way around. This was better in the healthy controls versus the psoriasis patients. And the periodontal risk assessment was further done by a somewhat complicated but additive scheme as shown here. We have the bleeding on probing, we have the gum pockets, tooth loss, bone deformities, and also diabetes and things like that. And the risk altogether was a lot higher in the patients with psoriasis, was statistically significant. And now the microbes. The microbial presence was much higher in psoriasis. There are several species that are hardly known outside the dental world, and in particular the Tenerella forsythia was more present there, but the overall presence was much higher in psoriasis. And the complexes, these can be divided in green, orange, and red complex, similar like the traffic lights. And the red complex was much higher in psoriasis. And the IL-1 genotype, there wasn't a really great statistical significance. However, there was a trend to be to the more severe form, that is, increased production of IL-1 and a reduced receptor antagonist content, but this was not significant. And to summarize, psoriasis patients more often suffer from periodontal disease. They exhibit a higher risk for periodontitis, tend to show a higher IL-1 mediated genetically predisposed inflammatory risk, and they exhibit a markedly higher load of periodontal pathogens. Therefore, dental health and dental treatment are important to reduce the pro-inflammatory burden in psoriasis. And periodontitis should be added to the list of comorbidities for psoriasis, just like inflammatory bowel disease or depression or cardiovascular disease. And the periodontitis is quite important, but hasn't been looked at very much. Thank you for your attention.
Thank you very much for interesting talk. Maybe time for one quick question, please.
Thank you for this nice clinical presentation. Sorry. Is there actually any response in periodontitis if you treat psoriasis patients with anti-IL-17 antibodies over longer periods of time?
Well, this, of course, is an important question, but it's hard to organize. You need all the infrastructure to do that. But overall, of course, we can assume if you're treating patients with anti-TNF or anti-IL-17/23, you make them more healthy, including the gum disease.
Hi, wonderful lecture. Quick question. In rheumatoid arthritis, there's a well-known association both with gingival disease, lung involvement, ACPA formation, et cetera. I wonder if you have an opportunity to look at whether there's any increased comorbid PSA or increased PSA risk over time with this gingival involvement.
We didn't stratify those, but also rheumatoid arthritis is known for gingival disease, and this is within the context of the inflammatory burden. Yeah. Okay.
For me, it would be just the other way around. If you actually treat the periodontitis, does the patient show less psoriasis flares?
I think IL-17 is faster than treating, but still, it has to be considered. It's certainly a focus, and it has to be taken care of to improve the overall progression. And we're always looking for stimuli for psoriasis. Infections are the strongest stimulus, and also the gingival disease caused by bacteria is also a very strong driver of psoriasis in that context.
Okay, thank you.
Thank you.